You hear me? Great. Good morning, everyone. A big welcome to this 4-day attempt at bringing forth interpretative aspects, direction towards management of patients, which pathology and all branches of pathology offer in their own aspect, in their own way. We have attempted to do this in 4 tracks. We have included clinical microbiology and infection control in track 1. We have included clinical hematology and transfusion medicine and the role that the hematopathology laboratory plays in track 2. We have included clinical biochemistry and chemical pathology, which is such a dynamic branch. I don't think there is another branch in pathology which is more dynamic, that changes from minute to minute as far as a patient is concerned, as biochemistry and chemical pathology can ever achieve. And of course, we have the all-important histopathology and cytopathology, which forms the background for action for any surgeon. No surgeon can function without the help of a very good dynamic histopathology department. Though, of course, many people would refer to it as morbid anatomy, but then it's not morbid anatomy. Everything about histopathology is not morbid anatomy. There's so much, it's progressed over the years, from postmortems to small biopsies, to liquid biopsies, to liquid cytology, and I don't know what all, immunohistochemistry and so on. So we thought it's an attempt to try and bring all of this together to make it as a comprehensive case-based learning, so that it brings us to very good interpretation of what results we give out from the laboratory. To cut a long story short, we have huge organizers of very great repute to take care of each of these tracks. May I call all of them on stage? The first, of course, would be, we are extremely honored to have Dr. B. Shashikaran, who was the former director of the National Institute of Nutrition, one of the senior-most pathologists in the country, to kindly come up and take his place on the dais, sir, right in the center. We're truly honored, sir, to have you on stage. May we call upon Dr. K. Gayatri, former professor, the Nizam's Institute of Medical Sciences, and a senior hematopathologist in the city of Hyderabad. And one of, Shashi, of course, needs no introduction. She is a well-known name in the country in the field of hematopathology. May I call upon Dr. K. Shanti Naidu, one of the senior-most clinical biochemistry consultants and a professor who was at the Nizam's Institute of Medical Sciences, and now for many years, I think more than 25 years, she's been a consultant clinical biochemist at the Care Institute of Medical Sciences in Hyderabad. May I request Dr. Kedar Deodar, Professor Pathology at the Tata Memorial Hospital and the co-organizer with me for this International Pathology and Laboratory Medicine course, and the course organizer for histopathology and cytopathology. And finally, may I request Dr. Sudha Ranganathan to come up on dais. She is a consultant and heads the transfusion medicine service at the Apollo hospitals in Hyderabad. Well, to briefly introduce the chief guest of this morning, and before that, I have a very pleasant duty to invite Dr. Kedar Deodar to welcome the delegates to this International Pathology and Laboratory Medicine course.
Thank you, Ayer, and a very good morning to all and a very warm welcome to all. It's a pleasant task for me, or pleasant job for me, I must say, to welcome all the delegates and all the faculty who have traveled from far-off distances to this course. This, we planned it as an international multidisciplinary course, and the idea behind it was kind of an amalgamation of different subspecialties, having a faculty which is renowned, experienced in the field of pathology, microbiology, hematopathology, chemical pathology, histopathology, and have an interactive course, kind of a case-based learning rather than completely didactic lectures, to have problem-solving things, problems that we face in our differential diagnosis, so routine matter. That was the idea. Another thought process when we conceptualized the program was that physical presence is better than the online presence, because I think we feel the interaction is better, because sometimes, on a lighter note, on an online assembly, we only hear mainly two questions. Can you hear my voice, or can you see my slides? But I mean, keeping that aside, this is truly an honor for me to actually welcome all our faculties, all our guests, and especially we thank Dr. Shashikaran for agreeing on consenting to be our chief guest at this forum. I'm particularly delighted to see actually many people from far-off distances, Guwahati, Sikkim, Andaman, who have registered for this course, and I'm truly thankful to them for taking this trouble. And lastly, I must add, I couldn't have done it without a strong and very warm support from our co-organizers, Dr. Ranganathan Iyer, Dr. Sudha Ranganathan, Dr. Gayatri, Dr. Shanti Naidu. I think it's because of them, we could have it in this particular place. At the last, I would thank Dr. Rahul Kulja, pathologist, for co-managing this facility, and also Rainbow Children's Hospital for giving a host a platform for this. So thank you all. Warm welcome once again. Dr. Iyer, you can take over. Yeah.
Thank you so much, Kedar. And now to formally introduce the chief guest of this International Pathology and Laboratory Medicine course this morning. We are truly honored to have you in our midst, sir, Dr. B. Shashikaran, who was the former director of the National Institute of Nutrition and ICMR Center in Hyderabad. He is a pathologist by training and has carried out research in the area of nutrition, food safety, and toxicology for more than 30 years. He has over 120 publications and chapters in 3 books to his credit. He's been instrumental in developing guidelines for the use of probiotics in foods, guidelines for very good manufacturing practices in food safety, guidelines for biosimilar drugs, recommended dietary allowances, and dietary guidelines. He was the director of the ICMR Center at the National Institute of Nutrition in Hyderabad from 2006 to 2012. He's been a member for more than 12 years and a chairman of the review committee for genetic manipulations, RCGM, for 2 terms, and a member of the Genetic Engineering Appraisal Committee, GEAC. He's been a fellow of the National Academy of Medical Sciences and a fellow of the International Medical Scientists Academy, a fellow of the AP and Telangana Academies of Sciences, a past president of the Nutrition Society of India, a public trustee of ILCI in India, a member of the governing body of the Nutrition Foundation in India, a member of the Scientific Advisory Committee for Gut Microbiota and Probiotic Science Foundation in India, a chairman of the Scientific Advisory Committee of Protein Foods and Nutrition Development, the Association of India, which is also called PFNDAI. We are truly honored once again to have you in our midst, sir. May I request my co-organizers, Dr. Gayatri, Dr. Shanti Naidu, and Dr. Kedar Deodar, as well as Dr. Sudha, to honor him with a few things. Just go up. Go up. Yeah. Dr. Gayatri, Dr. Kedar, come. First the shine. First the shine. First the shine. Give it to Dr. Gayatri. Kedar, madam, give. And you and Kedar give this. It's okay. Don't have to open it yet, it's okay. Thank you so much for being with us this morning. May I request the dignitaries to light the lamp of learning and inaugurate the session. Thank you so much, sir. And thank you so much, everyone on the dais, for having participated in the lamp lighting. Now, may I request, it's my duty to invite the chief guest to give his address to the gathering.
Good morning, everybody. And it's indeed a privilege to be present here at this international workshop, which is co-hosted by the RC Path. And I thank Dr. Iyer and Dr. Sudha for inviting me here today. It has actually been a good opportunity to meet several old friends. The emphasis is on the word friends and not on old. But it's really good to see, these are the only occasions when we meet people, and since, as Dr. Devdar mentioned, the physical meetings have become rare these days. And with that, our social interactions, our exchange of ideas, and all have come down. I remember Dr. Sundaram, Gayatri, we used to attend the IAPM meetings those days, and we used to meet great stalwart pathologists, and that was an inspiration for us when we were very young. I think the younger generation is probably lost out on that, on meeting the people and thereby, getting inspired for them to achieve something. And also thank Dr. Shanti and Dr. Gayatri for all the co-organizers. And this is a very important event, especially for the younger pathologists, younger hematologists, microbiologists, and transfusion medicine experts, to update yourself on a regular basis. I realized that the pathology I learned 40 years ago is not the same now. And I realized that, of course, I branched out into another field, and I realized that if I am asked to do surgical pathology now, I will not be competent enough. The reason is science is advancing so much that unless we update ourselves, we are likely to be left behind. And it's not just science, it's the technology which is also going even faster than the science. And especially in the areas like microbiology and biochemistry, the extent of instrument involvement has been progressively increasing. Sometimes we start wondering, 50 years from now, will we be required at all? So looks like a stage will come that a patient just walks into a kiosk and gets all the tests done. And then he puts that information onto his own mobile phone and he gets the diagnosis. And using the same phone, he also probably gets the treatment unless it's a surgical intervention. Even if it's a surgical intervention, there's a robot to do the surgery. Yesterday I was watching on the news that China has developed a robotic pregnant mother, where by in vitro fertilization you can put the embryo into a robot, and with all the environmental controls, you don't even need a surrogate mother. So that is the extent of advancement of knowledge. And will we be able to adapt to all these as we grow older? I very much doubt. Along with this comes the issue of artificial intelligence. I was happy to see that in one of your sessions there is a talk on artificial intelligence. Artificial intelligence is something which is going to be part of our lives, and we can't run away from it. On the contrary, we need to understand it better. You remember that whatever artificial intelligence is used in laboratory diagnosis, ultimately the report is signed by you or me. And then the question comes, if there is an error, who is responsible? Is it the algorithm which is responsible, or the creator of the algorithm, or you as a laboratory professional responsible because you're signing that report? So how do we ensure that our knowledge is appropriate to the technology which has come? I often find that each of you might have come across quite a lot of software professionals coming and saying that they are developing an AI technology in diagnosis of a hematological disorder or a cancer, etc., and asking you to give your retrospective material. Very often we provide the material because we just want enthusiastic about the whole thing. So whenever we give material for that particular person, we should also have a contract with them so that whoever is sharing the material is also party to whatever is the gains which comes out of that artificial intelligence. Many of you may be working in your own hospitals, and the hospitals at least should give approval for that. And more important than that is you have to ensure that the person who's developing actually understands what is the outcomes he's trying to plan. It has also been shown that artificial intelligence programs developed by retrospective data are unlikely to be effective or accurate unless they do it on prospective samples. So even artificial intelligence methods will have to go through the same kind of procedure like a drug development. If you know that in a drug development you've got phase 1 to phase 4 kind of trials, while up to phase 3 it is a controlled, randomized controlled trial. Phase 4 is the real one because that is the real world experience of what happens when people start using the drug in an uncontrolled environment. The same is true in artificial intelligence also. Retrospective data is sufficient for you to validate, but you need a prospective study on artificial intelligence before you use it in your day-to-day laboratory diagnostic methods and so on. So the technology is something we have to understand. We can't say that is something I don't know and I only share material like blocks or tissues or samples. Now, once we have this information, then there are also legal issues in using artificial intelligence. The question is, suppose a diagnosis goes wrong and the patient is suing us. Who is responsible? We or the people who develop the artificial intelligence? It's still a gray area. ICMR has actually got a guidelines. You can go to the website on the ethical use of artificial intelligence in healthcare and medical research. I think you should read all that. That shows what are all the potential risks we may be involved in if we use AI technology in our diagnostic without really understanding what it is. The second part is, while this amount of technology is going on, since I am in the field of nutrition, you know that the commonest hematological problem in this country is anemia, iron deficiency anemia. And the most important diagnostic parameter for classifying anemia is a simple hemoglobin. But even to this day, we are not sure which is the best method of doing a hemoglobin test. With all this advanced technology, there's a huge debate whether it's a venous sample or a finger prick sample, which is more reliable. We were traditionally using in our community studies the finger prick capillary blood and cyanometric hemoglobin method. But now with automated methods, etc., it has been shown that the venous hemoglobin is significantly different from the peripheral capillary hemoglobin. And we have wrongly been showing the prevalence of anemia to be so high. If you actually do a venous, there was a paper published by from St. John's, which showed that if you do capillary and venous, there's almost a 10 to 15% drop in the prevalence of anemia in this country. And we have all public health programs related to providing iron for reducing the anemia prevalence. So at the moment, the anemia prevalence is around 65% among pregnant women, lactating women, and children under 5 years of age, which is very high. And according to our National Family Health Survey data, between pre-COVID and the post-COVID time, there has been almost a 5 to 10% increase in the prevalence of anemia. Is it really an increase, or is it because of errors in our estimation? So in spite of all these advances technology, sometimes simple methods are still an enigmatic problem for all of us. And that reflects quite a bit in public health. And lastly, I'd like to say an experience that I was a part of the World Food Program of the United Nations, where we are providing iron-fortified rice to the people in this country through the public distribution. It contains iron, folic acid, and B12. And one of the objections before we released, this was part of the Prime Minister's PM Poshan program, which was announced 3 years back during Independence Day. Some of the scientists said that if you give this oral iron indiscriminately to the population, of course it was barely around 50% of the recommended daily intake. So they said there are a lot of thalassemics. I think Gayatri should bear me out on this. There are a lot of thalassemics in this country, so will this cause iron excess among these people? So much so, the objection raised resulted in the food regulator telling that on every bag of this rice, you should put a label saying that to be taken with caution for people who have got hemoglobin disorders. This was a big setback for the program, because once you put a warning label on a food, even ordinary people won't consume. They'll say, maybe it'll affect me also. So then a lot of hematologists, etc., got together and with a lot of research, and not research, a lot of going back into literature, and with their own knowledge, we clearly found that the iron toxicity in thalassemic cannot be due to oral iron, it's more because of a transfused iron. The difference between this is the transfused iron is unbound iron. That is, whatever iron comes out of the RBCs is not bound to transferrin. It's unbound iron, and therefore it's got a high oxidative potential, and therefore it causes tissue damage. Whereas an oral iron is always a bound iron. It's bound to transferrin and then to ferritin. And bound iron cannot enter a cell unless the binding is broken, and therefore it is not likely to be toxic. So it took hell of a time for us to convince the government that there is no risk for anybody having hemoglobin disorders, except in a small number of non-transfusion dependent beta thalassemics. Anemia also exists among these people in spite of transfusion, because their hemoglobin synthesis is defective, and they also have nutritional anemia, and therefore finally the government was convinced, and that was removed. So we go through a lot of issues in public health because of these various laboratory related matters. And so we have two sides of the same coin. On one side, we are faced with advancing technology. On the other side, we are still not clear about our basics and where to draw a middle line and then find the right path so that it benefits the patients and also protects us from various legal issues. So these are some things we have to learn as we go on. And I'm sure these on and off, as you keep meeting and updating yourself, you will become more familiar what's happening in the latest advances in your respective areas. That makes you as better professionals so that you can provide better health care to your patients. So I'm wishing you all the best and hope you enjoy the workshop. Thank you very much.
For your pearls of wisdom on proper use of AI, proper use of modern technology, and how to draw a line between the old and the modern. And now coming to a very pleasant area, and that is to thank everyone for having been a part of this program. First of all, A big thanksgiving to the Rainbow Children's Hospital, who have agreed and allowed me to be a part of this international pathology course organization, draw out time from my regular schedule of work at the hospital, and be an organizer along with Dr. Kedar Deodar, who is from the Tata Memorial Hospital in Bombay. My great thanksgiving to all my co-organizers of all the tracks, starting from Dr. K. Gayatri, Dr. K. Shanti Naidu, Dr. Kedar Deodar, and Dr. Sudha Ranganathan. My thanksgiving to the Royal College of Pathologists, who thought it appropriate to co-badge this event of the International Pathology and Laboratory Medicine course, and also accredit this course with CPD points, continuing professional development points, which is very, very useful to a number of us who are registered on the CPD and who wish or who probably are members who may, who may register for CPD in the future. We are thankful to the Telangana Medical Council, the State Medical Council of Telangana, for having thought it appropriate to accredit this particular course with 6 credit points. My great thanksgiving to all the guest faculty who have agreed to come at long notice, at short notice, and be a part of our gathering over here, share their thoughts, share their experiences with all of us. It's not just to the youngsters and to the postgraduates. All of us learn every day in medicine. And this is something which we all must remember. And a big thanks to the guest faculty. A big thanks to all my colleagues in the Department of Microbiology at the Rainbow Children's Hospital, in the Department of Transfusion Medicine at the Apollo Hospital, and all the other and all the other co-organizers in their respective hospitals. My thanksgiving to the technical staff who have been a big backbone of support to me in organizing this whole thing. It's no mean feat to be a local organizer for such a big event. My thanksgiving to all the supportive staff. My thanksgiving to yoke relievers, Mr. Dinyar Dupattawala and his entire team for arranging audiovisuals, for arranging the stalls, arranging the microphones, and arranging such a beautiful recording system. My thanksgiving to Mudrika Graphics, and led by Mr. Narayanan, for bringing out the online PDF version of the abstract cum souvenir book, as well as printing of the certificates. My thanksgiving to Saradi Travels for the airport transfers of the guest faculty outside of Hyderabad who have been arriving since yesterday and who will depart till the 24th of this month. My thanksgiving to the Hotel Abode by Venkateshwara, all the housekeeping and the food and beverages staff for their kind hospitality, as it has always been since the year 2015. That was the first time when we used Hotel Abode by Venkateshwara. Until date, it's always been the same. A big thanksgiving to the hotel staff. Thank you so much to the audience. Thank you so much to all those who have registered for this Royal College of, to this International Pathology and Laboratory Medicine course, taking out time from your busy schedules, coming to Hyderabad. A few of you all who are from outside of Hyderabad and outside of India particularly, for thinking it's still appropriate registering for this course and coming and joining us online. A big thanksgiving finally to all of you for being a part of this big event of learning. May I request all to rise for the national anthem. Thank you so much, everyone, all the dignitaries on the dais for being a part of this inauguration program. Thank you so much to the audience. I request everyone to join us for high tea. A few announcements before you rise for the high tea. Today we have 2 tracks today and tomorrow. Track 1 of clinical microbiology and infection control will be here in this hall of Temple View. There is a hall called the Jalsa Hall on the ground floor, which will be used for the track 2, and that is hematology and transfusion medicine. So delegates who have registered for transfusion medicine and hematology may have tea, and then please go down to the ground floor hall where you will find your registration kits, and the scientific sessions for hematology and transfusion will commence over there. Right? Thank you so much, everyone. I welcome all of you for a tea break.